You've done really well so far, and this last talk is about how you manage your condition. So we've talked about what the normal heart does. It's a powerful muscle, and its job is to move blood to where it's needed and to return blood back to the lungs to pick up oxygen. We've talked about what happens when the heart deteriorates and therefore cannot pump as strongly as it used to. The body responds, and the body responds by firing off arrows, which can further damage the heart. We've talked about the medications that we will introduce to block those arrows and to keep you well for longer. But today, it's over to you, and I want to put you in the driving seat and for you to know what to look for and what the enemy of heart failure is. So, the enemy of heart failure is fluid retention. Fluid retention that occurs in the lungs, the legs, and sometimes even the Tums. So, these are the sites of fluid, and they all occur because the heart is not able to push blood forward. If you remember the first lesson, blood always must go forward. But when blood doesn't go forward and is allowed to go backwards, then it causes fluid retention. And the first and the most common site of, I'll start, I won't call it most common. And the first common site of fluid is the legs. There are lots of people that may have swollen ankles and swollen legs, and this symptom of itself, if it's unexplained, can be a sign that you may have problems with the heart as a pump. So if you have got fluid in your ankles, make it your priority to go and see your GP or your clinician about that. So what can you do once you know you have heart failure? How do you know whether you are going to retain fluid again? Well, this is an acronym which I've created, which hopefully will help you know when you're retaining fluid. So D is for daily weight increase. It's really important when you have heart failure to weigh yourself every day. You don't have to write it down if it's the same weight every time, but it's very important to know what your weight is. So wake up, wee, and step on the scales, weigh. And your weighing scale should be on a flat, non-carpeted surface, and your weight should be roughly the same every day, up and down a pound. But when you start to gain fluid, you will start to gain weight, and you will start to gain weight suddenly. So if tomorrow you have noticed that you've gained 3 pounds and in weight, then please contact your specialist. Please contact your clinician, because this may be a sign that you are starting to retain fluid. So D is for daily weight increase. A is for ankle swelling. Ankle swelling is one of the main sites of fluid retention. Now, we've all had ankle swelling when we've been on the plane or we've had your feet down for a long time, but this type of ankle swelling is generally both ankles, and it's generally pits. By what I mean by that is when you push your finger in, it leaves a dent when you remove your finger. So if you have ankle swelling, or indeed if you've started to have swelling that's creeping up your legs, please don't hesitate. Please tell us, because this is your early warning system. This is what's going to keep you at home, and this is what's going to make sure you have the right treatment to be able to manage your symptoms. So this is very important that you understand your early warning signs and symptoms. I is for increased breathlessness. We're moving away now from the ankles and we're moving to the lungs. When the heart is not functioning, we're not pumping as it should be pushing blood forward. When it's unable to do that, then blood can back up the system and it can cause a high pressure, particularly in the lungs. And when that fluid from the blood seeps into the lungs, it can cause fluid to collect in the lungs. And when you have fluid in the lungs, it can make you suddenly more breathless than you usually are. And if you start to become more breathless or suddenly breathless, please contact your GP, your clinician, whoever manages your care, because it may be a sign that you have fluid within the lungs. And moving along from that is the next sign. Laying flat causes breathlessness. Now, when we go to bed, we lay generally on the same amount of pillows, but it may be that you go to bed and you think, I can't lay on the number of pillows I normally lay on. I need an extra one just to prop me up. And that's generally because if you have fluid in your lungs and you turn the lungs on its side when you lay down, that fluid can start to make you feel breathless. And you have to sit up. Now, this is not a reason not to go to the doctors, just add another pillow, but it's a sign that you may have fluid. So if you start to become breathless when you lay down, please don't delay, seek advice. The last one is you wake up suddenly. So you wake up suddenly because you're breathless. Now, this isn't because you've woken up, needed to pass urine and come back to bed and then being breathless. This is actually being fast asleep and then suddenly waking up, not being able to breathe, and generally having to sit at the side of the bed or go and sit in the chair downstairs. This is a really major sign that you may have fluid within your lungs. Please don't delay. If you ignore any of these symptoms, then patients often end up in hospital unnecessarily, and symptoms get worse, which affects your quality of life. So you know a bit more about heart failure now. This is basic information, this is basic information, but very important information about what the normal heart does, what it happens when it becomes damaged, but what we can do to manage you. If any of these things occur, then what you will be given are water tablets, diuretics, to remove the fluid, and it's really important that you get help to be able to do that. So I hope you've enjoyed this very basic overview of normal heart and what is heart failure. Please leave a comment below, and if you found it helpful and useful, then let us know, and more clips could be produced, such as on atrial fibrillation and how that works, about hypertension, a bit more about coronary artery disease, and maybe medications as well, and I would be happy to film them for you. Thank you.